So Andy Burnham, Shadow Secretary of State for Health, welcome to the Nuffield Trust Annual Summit. Can I ask you to explain whole person care in a minute and a half, please?
What a challenge. Well, the simplest way I could describe it would be an NHS for the whole person, able to see all of one person's needs, physical, mental and social. And that's the key bit, isn't it? We've had an NHS for 66 or so years that has been a medical model of care but hasn't been able to see people's social needs. And it's my judgment that in the 21st century, when ageing is one of the big challenges that we face as a country, that we have to have a system that can see all of one person's needs and can keep them in their own home and keep them healthy and happy where they want to be. And really that is the simplest way I could describe what whole person care is all about.
Now, clearly, a strong motivation for this is to make care better from the patient's perspective, from the family's perspective. But the NHS also has to save money. Now, how confident are you that some of the ideas that have come out in the recent report that you commissioned by Sir John Oldham are actually going to save money? Because some of them look as though they're great ideas, but are not necessarily going to result in savings in the short term.
Well, it's very much about both. It's about getting the best results we can for people from the money that is already being put into the health and care system. And the way I would put it, if we were to look the public in the eye and say, are we getting the very best we can for the 120 or so billion pounds that they put into the NHS and the social care system, then honestly, I don't think we can. Because what we have is a system that tends to hospitalise too many older people for the want of spending a few pounds where people want to be in their own home on a walk-in shower or a grab rail or something as simple as that. We seem to be happy to spend thousands of pounds keeping people in acute hospital beds, which are often the worst place for them to be. So this is about getting better results for people and better value for the money that goes in. So it's not either or, it's about both of those things.
The Nuffield Trust has evaluated a lot of interventions and projects that are designed to reduce emergency hospital admissions and has found in a lot of cases this doesn't happen in the short run. Are you confident that the evidence is there that if you invest in the community that you will see hospital admissions fall?
Well, we're looking at places where they've gone down this path. Torbay gets a lot of praise, but rightly so, because it embraced integration much earlier than other parts of England. And the evidence from there is that is exactly what has happened. They have been able to provide social care of a standard that is above the rest of England in terms of immediate response for the public on aids and adaptations or physios being available when people need them. And to pay for that, they've been able to close around 200 general medical beds in the local trust. So they've brought about a switch of care towards the home. And that's exactly what has to happen across England. Monitor have estimated the savings from integration to around £6 billion. I mean, that seems as though it has the right kind of level to me. It won't solve everything. But before we go and ask the public for any more, you have to say, are we getting the best of what they're currently giving? And at the moment, I genuinely don't believe we can say that.
Even if you get integration to work at some level in some parts of England, there is also a separate problem with the funding of social care and has been for several years. Are you going to commit to putting more money into social care, particularly for older adults?
The natural consequence of building the service in the way that I'm describing would be a switch of spending from the hospital to the home. And some of that spending would be on enhanced social care. That's exactly what has happened in Torbay and other places like it. But that, of course, wouldn't pay for all care. So it's obviously we have to be honest about that. And there's a separate debate needed about how the rest is paid for in the fairest possible way. And that is a debate that obviously will need to continue. But I'm very clear that this is the right way to go down this path, to kind of take away that huge divide between health and social care, to move away from this silo-based world where we have individuals having a random set of encounters with professionals, but nobody putting the whole picture together. I don't think we can afford the luxury of this silo-based working anymore. I think we need to see integration of commissioning and integration of provision. And that's very much what my vision is about.
Now, you've committed to avoid any more top-down structural reorganisations. Does this mean that in 2015, if you were to get into power to achieve your vision, there is nothing that you would want to change in the current structures that we have?
Well, no, I mean, that's not quite the same thing, is it? But the point is, politicians or people like me down the years have come along, and when you have a new policy, you've kind of made the assumption that therefore you need new organisations. And that has, made the NHS over time kind of become very disillusioned about constant change. So I'm not going to do that. I don't need new organisations to deliver this vision. To be honest with you, I don't think the NHS has the capacity to withstand another reorganisation. It's in my view, its capacity has been degraded by the current reorganisation. And so I have to be very conscious of that. The right thing to do is simply give those organisations that I will inherit a new job to do. And that new job will be integration, collaboration over the market and competition. And it's a different job to do. But what I also want to do is give them absolute clarity about what we want. What we want is whole person care, starting in the home, looking after all of one person's needs, preventive in character. It's a clear vision. I think what mine has that the last one lacked was utter simplicity about what we're trying to achieve.
Are there any organisations that you'd want to get rid of?
Well, I think we would ask all organisations to work differently, but I'm quite happy to work with the ones that I inherit. I think health and wellbeing boards are, for me, the most interesting because they embody that partnership between health and local government. And I think that is absolutely essential if we're to break out of the medical model of care and think more in terms of a social model of supporting people. CCGs will have a very important role in providing that specialist input that is needed when we're commissioning complex services. I think one of the problems in the current system is a lack of regional capacity. We've had a kind of shakeout of the SHAs, which has led to organisations working at a sub-regional level. I think a regional view is lacking in the NHS at the moment. So I would want NHS England or others to reinstate that broader view of regional health economies. But all of this can be done within the organisations that we inherit. To be honest with you, I think the current world needs simplifying. I think there are too many. I think it's confusing. The great irony, I think, of the reorganisation is that it brought us more complexity and bureaucracy, not less. And actually, I think the NHS is working in a more top-down fashion than it was before. With NHS England, it seems to me, calling all the shots. So I want to see more rooted at local level, more in the hands of local communities. But all of this can be done by asking the organisations I inherit to work differently.
Andy Burnham, thank you very much for talking to us.